Navigating your healthcare can be really difficult sometimes. Fortunately, here in Polk County, we have a great organization that is on your side and ready to help you with overcoming that task. Joining us today is Ermelinda Centeno. She is with the Central Florida Healthcare Incorporated. Actually, I didn't even know it had the INC at the end, but yes, Central Florida Healthcare Incorporated. Ermelinda, thanks for coming on today.
Thank you for having me.
Now, you know, the last time that you were on, we kind of talked about some different things that you had going on, the kids care or kid care program. Tell us a little bit about how that's been going and
Sure.
and about the program.
So with our kid care program, what we have been doing is we have just been doing a lot of kid care applications throughout this summer, especially with our back to school events. We were able to do over 400 physicals, back to school physicals, so that's including either just an annual physical that may be needed or a sports physical. All the immunizations that were done free, and throughout that time, any children who may have come in for a physical and didn't have insurance, then we at that moment would enroll them in the Florida Kid Care, do an application for them, and we were able to do over 100 Kid Care applications.
Excellent. Now, the Kid Care program, what is the Kid Care program?
Right. So the Kid Care program is actually the Children's Health Insurance Plan for the state of Florida.
Okay.
And also what it is, it's a program where, or insurance program I should say, that parents who work, it could be one person working or both parents who work, can apply for the insurance for the children through Florida Kid Care. And it insures children from birth all the way to the age of 18. Okay. And there are monthly payments, depending on your income. Sometimes it may be free, or you may have like a $15 or a $20 premium, monthly premium. And for other, depending on your income, of course, there are full charge rates as well. I want to say the highest you would pay with dental is right over the 150 mark, but it is changing. There's some changes being done on the prices, right, which is still very affordable, because the nice thing is that with the Florida Kid Care, you do not have a deductible, no co-payments to be paid.
Now, when you talk about the premiums and this is through the healthcare marketplace, right? Or is that a whole different thing? I want to say it's the same but yet different. Okay, in the same because what it is that if you put in an application through the healthcare.gov through the individual marketplace and you qualified for the Florida Kid Care program, your application will be sent over to Florida Kid Care. Okay, so they do work together, but it's not quite the same.
And so if I was to apply, let's say for a family and the mother and father and children don't have insurance, we apply them through Florida Kid Care, and the children qualify for Florida Kid Care, but then because it's an insurance for children, then the adults in this case would be then referred to the marketplace. Okay. And so that's how that works, where it works together, but yet it's separate insurances. Right.
Now, the Central Florida Healthcare, that's kind of what you guys specialize in, is handling, and especially now with the individual marketplace, still, even a year after being implemented, still a lot of questions floating around, a lot of, you know, confusion, and that's what you guys are here for, right?
Yes, we're here for, and a lot of the things is like a lot of people, sometimes the confusion is that, oh, the marketplace is closed, so we can't apply, but that's not the case. And I really encourage everyone, every day we make sure that we talk to any patient who comes into our center or anyone from the community who does not have insurance, because if you qualify under a life-changing event, then you may still apply today for the insurance through the individual marketplace.
There are some exemptions.
Right, exactly. And so you would qualify into that. But open enrollment will be in November 15th, where when we say open enrollment it is open from November 15th until January the 15th for you to apply and continue to apply for insurance.
Or change the insurance you
have. It doesn't matter if you have a life-changing event or not. You can go in and at that moment and apply. And then once the doors close, the open enrollment period closes, then what happens is we really encourage people to still come, because depending on your situation, then we would call and see if you did qualify for a life-changing event.
Okay. Now, when you say a life-changing event, give me some examples. What would be?
Sure.
I mean,
It could be because you've had a baby, because you moved.
That's life-changing.
Yes. Because you've moved, maybe someone in your family passed away, and it affected, if let's just say one of the spouses, you had insurance from a spouse, and they passed away, and now you don't have insurance. It's considered a life-changing event.
What about a family member that might need to move in with you due to illness or something
right.
like that?
In that situation, I would definitely have anyone come in. And the other thing is that because anytime you have an income change, then you should definitely come in to see us so that we can help you. We'll call the marketplace for you or with you, and make sure that any income changes, either that a decrease or an increase, should be reported throughout the year.
Right, and it's I would imagine it's probably a lot easier to deal with because the marketplace is a big, giant, conglomerate. Having an organization like you on your side probably makes that whole process a lot smoother than if you were to just individually call your insurance company or whatever and try to get things adjusted. I'm sure you probably hold a little more clout.
Yeah, well, we have 9 certified application counselors for working for Central Florida Healthcare, and we all have been trained, and we, through experience, and it's a learning every day. We learn every day because everyone's situation is different, and so I definitely encourage, and you don't have to be a patient to come and receive our services. Just look us up on our website, www.cfhconline.org, and call one of the centers. Right now, all of our centers have navigators, and we're the PCMH navigators.
I love it when you say navigate. I always think that I picture you in a sailor's hat.
Yeah, and we're called navigators and not an actual certified application counselor, only because a navigator is a term I feel that is used and known more among people, and we refer ourselves like a patient navigator, where we help to navigate and help you to eliminate any barriers to go to healthcare, and our focus is in health insurance.
And the great thing is that you guys have locations all over the place.
Yes.
I mean, I'm looking at this list of course, you serve more than just Polk County. You're in Highlands and Hardy as well, right?
Yep.
And so you've got, a location here in Lake Wales that also supplies dental care.
Yep.
Dundee, Frostproof, Winter Haven, Lakeland. The Frostproof one actually serves dental care as well. Right? You said it was.
Our Lake Wales office is only dental.
Okay. And then Mulberry. You're opening up a new one in Mulberry, right?
Yes, and Mulberry is very, very exciting. And right now we're working out of a portable, but we will be having a 2-story building there soon. And really excited. And I will definitely be back, and hopefully we can even show some pictures and things like that to show the community that Central Florida Healthcare is there to help.
Now, Ermelinda, I know you've been on the shows, we've had a chance to talk, and you're always a very busy lady. And you've got things going on all the time. What's some of the new stuff you've got? Yeah,
so right now I'm actually working with Central Florida Healthcare and Polk Vision, and we're working with a community needs assessment for Polk County. So I really would love to share the website with you all. It's www.polkhealth2014.com, and take our survey about health and quality of life in Polk County.
Well, Ermelinda, it's been great having you on, as always, and we look forward to seeing what progresses in the future here. You guys have so many great services available to the community, and as always, great talking to you.
Thank you for having
me. Thanks, Ermelinda. The Central Florida Healthcare, they are doing a great work here in Polk County, and if you're watching us on YouTube, they're available in Hardy and Highlands as well. They've got locations in Avon Park, Wauchula, so they're everywhere, and there's no reason not to seek out their help, especially if you've got kids. And you may need some assistance in trying to get them insurance. The Kid Care program is a great program that you can utilize, and Central Florida Healthcare will help navigate you through the whole process. You can call them at 863-452-3008, and you'll be able to get a hold of somebody there, and they will help you and help you get through your healthcare system. You can also visit their website, which is the best place to go because you're going to get all the information that you need from their website at cfhconline.org.